Good morning and welcome to your Farm and Home Show. I'm Kristi and this morning we're visiting with Sarah Widener. She's the Health and Wellness Director for Med Center Health. Hey, Sarah.
Hey, good morning.
Good morning, Sarah. Well, National Stroke Month is happening right now, and today you are going to talk to us about that. Sarah, what are the risk factors for stroke?
So stroke risk factors include both controllable and uncontrollable risk factors. So your controllable risk factors are going to be your blood pressure, managing your cholesterol, managing your weight. If you have diabetes, keeping it managed, and physical activity. So making sure that you're staying physically active. If you smoke, quitting, being a healthy weight. So those are all your controllable risk factors. Your uncontrollable risk factors for stroke include your age. So as we get older, our risk for stroke increases. Your sex, so younger men and older women are at higher risk. Your family history, if you have a family history of stroke, then you're going to be at a higher risk. Your race, and then also if you've had a prior stroke. So those are all going to be things that that do increase your risk for stroke.
And this is really important information to know so that you can be aware. Sarah, what are the signs and symptoms of stroke?
Signs and symptoms of stroke include, we like to use the acronym B FAST. So B is for balance, if somebody's balance is all of a sudden off. E is for eyes, so if you have sudden blurred vision or a sudden change in your vision. Face, so if your face is droopy on one side. Arms, so if you lift your arms but you can't get one up or it just falls back down, that's going to be another symptom. Speech difficulty, so maybe you're having trouble getting your words out, maybe you know what you want to say, they're not coming. And then time, so time is that important piece that we want you to call 911. So be fast is the acronym that we use.
Sarah, what should you do if you think that you or someone you know possibly might be having a stroke?
So if you think you or somebody you know is having a stroke, we want you to take this seriously. Time is brain cells, and you're losing brain cells that you're not going to get back. So we want you to call 911. There's things that the EMS can get going on the way to the emergency room. And better safe than sorry. So even if it's what we consider a mini stroke that you're having, knowing that and knowing what your risk is.
Sarah, how can someone reduce their risk for a stroke?
So to reduce your risk for stroke, number one, you want to know what your risk factors are. So again, the ones I mentioned. Your age, your sex, if you're female or a younger male, your family history, you want to know those important pieces. So you want to know what that beginning risk is, and then what are your controllable risk factors. So if you need to lose weight, lose weight. If you're not physically active, get active. If you have diabetes, make sure that it's managed within control. If you're smoking, it. So that's one of the big things. And if you have high blood pressure, it needs to be managed. So you really need to talk to your doctor. That's one of the big risk factors that we see. So just knowing what your risk is and then controlling the things that you can.
Such great information, Sarah, and you all offer so many classes and programs through Med Center Health. If someone is interested in contacting you all and learning more about the different programs you have, how can they get a hold of you?
So they can call us here at Health and Wellness at 270-745-0942, and we're happy to direct them to what they're looking for.
All right, Sarah, thank you so much for being with us today. Thank you for joining us on the Farm and Home Show. And if you have any questions about National Stroke Month, please be sure to contact Med Center Health. Thanks for joining, and we'll see you next time.